Alright,
We got your equipment?
Yep. Yeah, I'll just chop off with that part. Whoa. Alright, so we have a female baby. Their heart rate's 128. Normal range is 120 to 160. Their respiration rate is 48. Normal respiration is 40 to 60. Systolic blood pressure is 88. Normal range 90 to 60 or 60 to 90. Their head circumference is 14. Normal is 13 to 15. Weight for this female is 8 pounds. That's normal. Normal is 6 pounds 3 to 8 pounds. 14 ounces. Length is 20 inches. Normal length is 19 to 21 inches. Temperature is 99.2. Normal temperature is 97.7 to 99.5. Female infant here. I'll start by just assessing general appearance. We would calculate all of their growth and weight on a chart. We're assessing their alertness right now. I'm going to go ahead and look at their skin. Assessing skin for cyanosis, acrocyanosis on the extremities, modeling of the skin. Flip them over here, support their head. Looking for any bruises, hemorrhaging, bleeding, any contusions. Looking at their head, checking for symmetry of the head. Lift up their head and we're going to feel their fontanelle, check and see if it's sunken, dimpled, or flat. Our sutures, our coronal suture, our sagittal suture, metopic suture, anterior fontanelle. Go into our eyes, going to assess the canthi, seeing if they're deviated upward or downwards. Look for our red reflex in here. You see red reflex. Assessing for leukochoria. Conjugate gaze, pupil equal fall of the light, spreading their eye, looking for any injection on the cornea or the conjunctiva, cornea, sclera injection, looking for excessive tearing or discharge, direct conjugate gaze or disconjugate. Disconjugate can be normal in an infant. Next, we'll be assessing the ears. Ears should be positioned 90 degrees from the lateral canthi up to looking for our positioning, size, location of the ear. All anatomic features here. We have our tragus and external acoustic meatus. On the other side, size, position, location of the ear. And check the canal, patency. Looking here, I'm going to hold down and back, patent canal, okay, canal patency. I'm going to check their nose, I'm going to look in there, we're going to push down on it and look for any respiratory distress indicating patency of the nose, philtrum, presence of that. If they lacked a philtrum, that would indicate possible fetal alcohol syndrome. Looking for symmetry of the nose. With the gloves on, I'd examine their mouth, my finger, feeling the hard and soft palate for any clefts, Epstein's nodes, feeling the gums, looking back here at the uvula, assessing for bifid uvula, assessing the tongue, the frenulum with the tongue for a short frenulum, looking at our gums and our lips here. And assess the neck. We're going to check full range of motion. We'll have them just turn here up and down. Feel our clavicles. Looking for any webbing of the neck, pits, skin tags. Also on the ear, I'm looking for skin tags and pitting on the ear. For pulmonary, looking at the rib cage, feeling for any deformities. The sternum. Any deformities in the sternum. Nipples, looking for extra nipples. The breast, size and location should be centered. Fourth IC. We're going to listen to we're looking for any signs of respiratory stress, such as cyanosis, grunting, nasal flaring, flailing of the chest could indicate a possible atelectasis. Listen to the lungs now. cardiovascular. Go ahead and listen to the heart. Alright, we're going to inspect. Also cap refill, checking cap refill, under 2 seconds. We're going to check femoral pulses bilaterally. If I detected a difference in the femoral pulses, I would then check brachials, radials, or pedal pulses bilaterally. Next, we're checking the abdomen, looking for contour of the abdomen, should be slightly protuberant. We're going to auscultate all quadrants for bowel sounds. We're going to palpate spleen here, feel our liver edge, kidneys. Moving along to GU, the female, we're going to be inspecting for the labia, presence of them, the vaginal opening, the presence of the hymen, the shape of the hymen, any vaginal discharge, the clitoris, the location of the urethra, looking for the anus, the position and location, patency of the anus, which would be assessed after a bowel movement. Looking at the umbilicus, looking for 2 arteries, 1 vein, there should be 3 vessels in here, assessing for any bleeding. Extremities, counting all fingers, there should be 5 fingers on each hand and 5 toes on each foot. Looking for any webbing or fusion, assessing joint mobility of the wrist, elbow, and shoulder. Bilaterally, also assessing for symmetry. Go ahead and move our hips here and do Barlow's test. And come in and down. Do our Ortolini. Alright, knee move flexion, extension, ankle. Also, on the skin, I would assess their back for Lugano or any vernix throughout the body. The spine, while we're on the spine, support their head. Just going to palpate the spine all the way down, looking for any dimpling at the bottom or tufts of hair, any obvious spinal deformities felt on the spinal column. Neurologic, can assess the level of alertness of the child, the muscle tone, the support of the head, lift up. His arm should be flexed. He's had good tone throughout the, or she's had good tone throughout the exam. And the movement of the extremities, primitive reflexes, so we'll do suckling, the rooting reflex, or stroke their cheek. Babinski, this infant would have a positive Babinski sign. General level of distress, as stated. All right.
8 minutes.
How many?